Hi, my name is Dr. Emily Splichal, functional podiatrist and human movement specialist. A condition that I see in many of my running patients, especially in the runner, that is transitioning from supportive heel strike shoes and running patterns into a more minimal barefoot and a midfoot strike pattern, is top of foot pain. Now, if you Google this term, top of foot pain, what you will often come across is a concept that is called too much, too soon. What I want to help you to understand, though, is that top of foot pain is really a compression and a jamming of the foot bones during foot contact. It also is often associated with stress to the ligaments on the top of the foot. Now, what I want you to appreciate is that every time your foot strikes the ground, you want it to unlock and create movement. That is how we absorb energy and the impact forces. Now, depending on your foot type and your foot mobility, as your foot contacts the ground, you may not have sufficient unlocking and you start to jam all of these small bones in the middle of the foot. What can happen is that jamming and the hitting of the bones starts to create inflammation and irritation to the small joints and ligaments. So top of foot pain, yes, as much as it may be too much too soon, it's actually uncontrolled impact forces entering the middle of the foot and insufficient unlocking and absorbing of that energy. I would put a diagnosis around top of foot pain as a midfoot sprain. Now, a midfoot sprain and jamming of the bones creating inflammation can actually lead to stress fractures. And typically where those stress fractures start to occur are these small bones, the cuneiforms, the bases of the metatarsals. So if you are starting to experience top of foot pain and are maybe a runner transitioning into more minimal footwear or a midfoot strike pattern, you want to focus on a couple of things. First is make sure that you have optimal foot mobility. Release the feet on a consistent basis. Release the calves. Second, you want to make sure that you have sufficient sensory stimulation coming into your feet. Can you feel the ground? Are your feet sensitive to the vibration coming in through impact forces? I encourage you to bring barefoot stimulation or to look at the Naboso insoles and product line. And then third is you need to have sufficient foot strength. Foot strength means to have strength of your intrinsic muscles. There's an exercise called short foot that I recommend to almost all of my patients. So addressing top of foot pain and a midfoot sprain is really based off of foot mobility, foot sensory stimulation, and foot strength. To learn more about top of foot pain and all foot conditions, please visit dremilysplichal.com.